if we were to...
I think you called it the sternum to begin with, Kirk.
Oh, I'm sorry, clavicle. Okay. Now, the scapula. There's a number of anatomical landmarks on the scapula that we want to be familiar with. First of all, always define the socket portion, which is better known as the glenoid fossa, as the lateral side of that scapula. And then the surface of the scapula that has no projections coming out of it, other than this projection up here, this will be the anterior side. This will be the side that will be facing the ribs, as opposed to this side of the scapula that has this rather large bony projection extending out. This is the posterior side. So when you're looking at the scapula like so, you're seeing the posterior side, the anterior side. This is going to be medial, and of course this is a superior direction. So looking at the anterior surface of it, we have a rather large, shallow depression. All this area through here, this is the subscapular fossa. Subscapular fossa. Likewise, if we turn it around and look at the posterior side, we've got two fossas. But to define the two fossas, define this ridge first, and call this ridge the spine. Now, this portion of the scapula can be felt on a person's back. And the depression above the spine, all this area that I'm putting my fingers in, is supraspinous fossa. And then likewise, all of this large depression here that I'm laying my fingers along below the spine is infraspinous fossa. These depressions are completely filled in with muscle. Laterally, this fossa is the glenoid fossa, which receives the head of the humerus to create a ball and socket type of joint, the shoulder. Then two large projections. The biggest projection that is extending out laterally is the acromion, or you can call it the acromial process. It is here where the clavicle will articulate. And then a smaller extension, extending just superior to the glenoid fossa, being the coracoid process, which is there for muscle attachment. So, the scapula. Now, going down into the upper extremities. The upper extremities is going to consist of the humerus, being the large bone within the upper arm, two bones down here in the forearm, the radius, which if we have an anatomical position is lateral, or if you always notice the radius is always on the thumb side, and the one that is more medial is the ulna. And then getting down into the hand, in the area of the wrist, there are 8 individual bones called carpals. And then getting down into the hand, we've got metacarpals, then down into the fingers, phalanges. So let's go back and take a look at all that in a little bit more detail. So I'm going to be directing your attention to an individual humerus. Now, the large rounded head obviously is always superior. And since that articulates with the glenoid fossa of the scapula, then this also faces medially. So this direction is medial, this direction is superior. Also, where you have the shallow depression at the distal end, as opposed to the large, deep depression at the distal end, makes this the anterior side. So you identify the shallow, smaller depression as the anterior side. So you're looking at the front of the humerus. Now, as far as its individual parts, the head of the humerus. And then you've got two bumps, one here and one here. This one is the greater tuberosity, and this one is the lesser tuberosity. The lesser tuberosity is actually more of a sharper projection than what the greater tuberosity is. But if you look at this, you'll see that the greater tuberosity is much broader, so therefore called the greater tuberosity. There's a groove that is between those two tuberosities. Our objective sheet has it listed as the bicipital groove. Your textbook is calling it the intertubercular sulcus. I prefer, myself, the bicipital groove. I think it's an easier term to use, and I think that's what the majority of anatomists would probably call this. If we go down to the distal end of the humerus, then keep in mind that this side is medial, and this rather large bump that is projecting out here is the medial epicondyle. This projection can be felt quite easily here on the medial aspect of the elbow. Then if we go more towards the center, this depression here is the coronoid fossa, which will receive the coronoid process of the ulna to make up part of the elbow joint. This rounded area here that has somewhat of a little bit of a groove to it, that I've got my finger laying in, if I extend around like so, all of this area here is referred to as the trochlea. It's referred to as the trochlea. And then this portion that's more rounded is the capitulum. The trochlea is where the ulna will articulate, and the capitulum is where the head of the radius will articulate. Laterally, we have a lateral epicondyle. So the distal end is kind of busy here. We have a medial epicondyle, we have the trochlea, and we have the capitulum. We have the coronoid fossa, and we have the lateral epicondyle. Turn it over so you look at that distal end on the posterior side. Again, keep in mind this is the medial epicondyle. You are now seeing the posterior side of the trochlea and the posterior side of the capitulum, but then this rather large depression here is the olecranon fossa, which receives the olecranon process of the ulna to comprise, again, part of the elbow joint. So, the humerus. Now if we go down into the forearm, two bones are the radius and the ulna. Thing to remember as far as which side is which, the radius is always on the thumb side. Whether you have your arm supinated or pronated, the radius is on the thumb side, which would make it the lateral side if you're looking at it in the anatomical position. Let's consider the ulna first of all. I easily identify the ulna because I think it's the one that kind of looks like a wrench. Now, as far as its component parts, this portion that does look like the wrench here, wrench end, is the proximal end of the bone, as opposed to the distal end of the bone. Where you have the large indentation, this is the anterior side. It's going to be the anterior side. And if you look here at the proximal end, there's a very faint, smooth depression that we will refer to as the radial notch. And that's where the head of the radius will articulate. And since the radius is on the lateral side, then this defines the lateral side of that ulna. Now, as far as some of the major landmarks, the large indentation here is called the semilunar notch, because it looks like a half moon, or you can call it the trochlear notch, because it articulates with the trochlea of the humerus. This projection sticking out here is the coronoid process, which extends into the coronoid fossa on the anterior side of the humerus, which limits the amount of flexion that you can do at your elbow. And if we look at the posterior side, then this large rounded projection here, which is the rounded projection here of your elbow, is the olecranon process, or you can use it as a noun, the olecranon. And it is this that fits into the olecranon fossa on the posterior side of the humerus, which then restricts the degree of flexion that you can, or the degree of extension, excuse me, that you can do with that humerus and the ulna to comprise an elbow. If we go to the distal end of the ulna, then this projection that is extending down here is the styloid process. This point can easily be felt. If you examine the wrist on the medial side, then a bump that can be felt here would be the styloid process of that ulna, extending out like so.